Good morning. I'm going to do an Ezpap. So the first thing I'm going to do is check the patient's chart, and then I'm going to gather the necessary things, and then I will knock on the door, introduce myself, then check the patient's ID band. I will wash my hands, make sure my hands are clean, and then apply the appropriate PPE. So that I will just apply some gloves since it's just a breathing treatment and I don't have to worry about any splashing. So I'm going to assess the patient beforehand. Before any treatment, I'm going to assess them, like listen to their lung sounds, and I'll check their vital signs. And then I'll position the bed. If they're laying down, I'll position the bed in an upright position so that way they get the best lung volume with their lungs for the treatment. And then I'll explain what an Ezpap is for them. Alright, so here we have an Ezpap. So this is going to help you give it a positive pressure flow through your lungs. This will help loosen up any secretions, and it will also help you cough up any secretions that are in your airways and your lungs. That way you don't cause any atelectasis, anything like that. So when we are ready, we'll set it up here. So here's the Ezpap. It's just a little small device here. Today I'm going to want to read your inspiratory flow rate and everything. So I'm going to connect a direct pressure manometer here to see what the pressure is. And so I would connect it to here. There's a couple ports, so I connect it to the smallest port. And so this one's going to connect to an oxygen source. So it's going to be a little more noisy, but it's not going to be overwhelming. So you're going to connect it to here. And then I would connect it to the oxygen source, started at 5 liters per minute. You don't want to exceed their inspiratory or exhalation rate at all. That way you don't overwhelm or ventilate the patient. And so then when we're ready, I'll instruct the patient to hold it like this. We don't want to hold it upside down because then the meter won't read properly and it won't get the proper flow. And instruct the patient not to cover the end piece, as that will include the positive pressure that it creates inside the Ezpap. So here we can have a mouthpiece, or they can, if they can't do well with that, we can place a mask on it. And so what we're going to do is have a 1 to 3, 1 to 4 ratio. So they're going to breathe in for 1 second and exhale for 3 to 4 seconds. So when they're ready, we'll have them do a nice deep breath in and out, and they can keep their mouthpiece on, leave their mouth on there. They can do the inhale and exhale with it on, with their mouth around the piece. And then when we are finished with it, after they've done it a few times, we always give them a break in between, but we'll have them do this every hour, and we'll help them along with it. But if we don't need the manometer, we would remove this and dispose of it. And the next time we'll just make sure we have to close the port so that we don't get any excess air into the port. And that way we know it's working properly. And so when we are finished with it, every treatment with this, we'll always have the patient do a nice deep cough. If they cough up anything, if we don't need the sample for the lab, we just have them cough into a basin. But if we do need the sample taken to lab, then we'd have a lab cup for them to cough it into, and then we would just chart down any of the distinction of what they coughed up. So when we are finished, we'll remove it from the oxygen source, shut off everything, set the tubing in an appropriate area, and place this in a safe area, and instruct the patient not to wash it with anything, to just let it air dry, so that way we don't ruin anything since we'll be using it again. And then I'll reassess the patient. I'll listen to their lung sounds, see if it's helping improving their lung sounds, and then chart down their vital signs after the treatment. And then I'd reposition the patient to where they'd like to be if they'd like to lay back down. And then I'd remove my PPE and then wash my hands. And then I'd go and chart on the patient's chart and let the doctor know I did a breathing treatment with them.